Hello, my name is Duggan, and I want to welcome you to my presentation on prescribing medications. In this presentation, we will talk about shadow health patients and focused exams, discuss the medications prescribed for each patient, and discuss alternative medications that could be used to treat each patient and their disease process. First, we will talk about the patient with urinary tract infection. This patient is a 21-year-old female who has complaints of frequent urination with burning sensation and a brown, cloudy urine for the past 3 days. She is currently on loratadine for her seasonal allergies as well as birth control. According to urinalysis, the organism causing her UTI is resistant to Bactrim. The medication prescribed for this patient's UTI was nitrofurantoin. This is an anti-infective medication used for both the treatment and prevention of UTIs. Nitrofurantoin kills the organisms that cause UTIs. About 30 to 50% of the drug is metabolized by the liver, and it's excreted through the kidneys. Nitrofurantoin should not be taken by patients with hypersensitivity to it, those with renal impairment or hepatic impairment, or those who are pregnant or breastfeeding, because it crosses the placenta and enters the breast milk. Drug interactions include antacids, which may decrease the absorption. Neurotoxic drugs cause neurotoxicity. Hepatotoxic drugs, hepatotoxicity. And pulmonary toxic drugs could cause pneumonitis. Side effects include dizziness, drowsiness, headache, nystagmus, rust-colored urine, photosensitivity, nausea, vomiting, abdominal pain, and diarrhea. Patient teaching should include that the medication should be taken as directed around the clock, that missed doses should be taken as soon as possible within 2 to 4 hours from the next dose. This may cause dizziness or drowsiness and discoloration of urine. It's important to tell the patient that so that they don't freak out. The patient should notify her healthcare professional if she has symptoms of superinfection, such as fever, chills, cough, chest pain, dyspnea, milky or foul-smelling urine, or diarrhea, and she should not attempt to treat the diarrhea without consulting the provider. She should also notify the provider if she has symptoms of allergic reaction. In addition, she should feel relief from symptoms within 3 days and should contact the provider if there is no relief or if it gets worse. Phenazopyridine is a non-opioid analgesic. It relieves urinary tract infection symptoms by working locally on urinary tract mucosa to dull the pain. This medication is excreted in the urine and should not be used in patients with hypersensitivity to the drug, glomerulonephritis, hepatitis, uremia, renal failure, renal insufficiency, glucose 6-phosphate dehydrogenase deficiency, and those who are pregnant or breastfeeding, because there's not enough information known about the effects on the fetus or the infant. There is no significant drug interactions with this medication. The side effects for phenazopyridine include headache, vertigo, nausea, bright orange urine, or renal failure. Patient education should include warning the patient about that urine color and that it can stain clothing and even soft contact lenses, because it can be a shocking thing to see. This medication should be taken as written and only as long as discomfort persists. Although this medication may be stopped before the full 2 days prescribed, the antibiotic should be continued for the full course of treatment even if she feels better before then. The patient should contact the provider if she develops rash, skin discoloration, or unusual tiredness. Another antibiotic that could be used for this patient to treat the UTI is ciprofloxacin. This is an anti-infective fluoroquinolone that is used to treat bacterial infections, including UTIs, cystitis, and prostatitis. It works by inhibiting bacterial DNA synthesis, resulting in the death of the bacteria. Ciprofloxacin is metabolized by the liver and excreted by the kidneys. Therefore, it is contraindicated in people with renal impairment or those with cirrhosis. Patients who have hypersensitivity to this medication or who have myasthenia gravis should not take it either. This medication also crosses the placenta and enters breast milk, and safety is not established. So pregnant women who are or those who are breastfeeding should avoid it as well. Ciprofloxacin has many drug and food interactions. There is a high risk of torsade points when taking erythromycin, quinidine, or some antipsychotics or tricyclic antidepressants. Theophylline can lead to toxicity. Some antacids, iron salts, zinc salts, bismuth subsalicylate, and sulforaphate can decrease absorption of this medication. This medication may increase the effects of warfarin and may decrease the effectiveness of phenytoin. Antineoplastics may also decrease levels of ciprofloxacin. Corticosteroids may increase the risk of tendon rupture, and this medication may increase the risk of hypoglycemia when used with anti-diabetic agents. Foods such as fennel, dairy products, and anything with calcium may decrease the absorption of this medication as well. Patients should be aware of the side effects. These include headaches, dizziness, insomnia, seizures, intracranial pressure, agitation, confusion, depression, drowsiness, hallucinations, tremor, abdominal pain, photosensitivity, rash, hyperglycemia, and hypoglycemia. Patient teaching should include awareness of all of these side effects, as well as wearing sunscreen for the photosensitivity and increasing fluid intake to at least 1,500 mL per day. Patients should take medication as directed for the full course, even if feeling better before it is completed. It is critical for patients to understand that stopping medications early can create resistance to medication, which is a global problem. The patient should notify a provider if taking any over-the-counter medications or supplements due to the interactions. As always, patients should notify the provider when having symptoms of allergy or superinfection, such as a furry overgrowth on the tongue, vaginal itching or discharge, loose or foul smelling stools. Next, we will discuss the patient with a community-acquired pneumonia. Patient presents with a productive cough with rust-colored sputum, stuffy nose, lower right chest pain that is a 2 out of 10 at rest and a 10 out of 10 with coughing fits, exhaustion for 3 days, and a fever since last night of 100.1. She has hypertension, for which she takes trandolapril, verapamil, and chlorothiazide. She also takes vitamin D and calcium daily. She started taking aspirin. It was 325 milligrams. She was taking 2 tablets of that 4 times a day for the chest pain, but she has had no relief, and she has no medication or seasonal allergies. So Augmentin, amoxicillin clavinate, is an anti-infective aminopenicillin and beta-lactamase inhibitor. It treats infections such as pneumonia by binding to the bacterial cell wall, resulting in the cell death. It's absorbed in the duodenum and is more resistant to stomach acid than other antibiotics are. Augmentin is metabolized by the liver and excreted in the urine. It also crosses the placenta and enters the breast milk. Patients who have hypersensitivity to this medication or to penicillins or clavinate should not take this medication. Those patients with renal insufficiency or hepatic impairment should also avoid this medication. Patients with infective mononucleosis may develop a rash with this medication, and so may be used carefully in that instance. The medication may increase the effects of warfarin, and it may decrease the effects of oral contraceptives. Foods high in fat may actually just decrease the absorption of Augmentin as well. Side effects of Augmentin include seizure, diarrhea, hepatic dysfunction, nausea, vomiting, or vaginal candidiasis. Patient education should include taking all of this medication around the clock as directed. Patients should finish entire medication dose even if feeling better before done. Because this medication can decrease the effectiveness of oral contraceptives, patients should use backup birth control methods during treatment, and you must make sure that they know this. Patients should watch for signs of allergic reaction or superinfection and notify the provider immediately. And again, that superinfection is going to be the furry overgrowth on the tongue, vaginal itching or discharge, or loose or foul smelling stools. Another antibiotic that could be used for this patient to treat the pneumonia is levofloxacin. This is an anti-infective fluoroquinolone that is used to treat bacterial infections, including pneumonia. It works by inhibiting bacterial DNA synthesis, resulting in the death of that bacteria. This medication is metabolized by the liver and excreted by the kidneys, and it is contraindicated in renal impairment or those with cirrhosis. Patients who have hypersensitivity to this medication or who have myasthenia gravis shouldn't take it. This medication also crosses the placenta and enters the breast milk, and safety is not established, so pregnant women or those who are breastfeeding should avoid it as well. As with ciprofloxacin, levofloxacin has many drug and food interactions. It's the same ones. It's a high risk of torsade de pointes when taking erythromycin, quinidine, some antipsychotics, or tricyclic antidepressants. Theophylline can lead to toxicity. Some antacids, iron salts, zinc salts, bismuth subsilate, and sulforaphate can decrease absorption. This medication may also increase the effects of warfarin and may decrease the effectiveness of phenytoin. Antineoplastics may also decrease levels of levofloxacin. Corticosteroids may increase the risk of a tendon rupture, and this medication may increase the risk of hypoglycemia when used with anti-diabetic agents. Again, foods such as fennel, dairy products, and calcium may decrease the absorption of this medication. The side effects and patient teaching for this medication are the same as those for ciprofloxacin. Next up, we have a patient with chronic obstructive pulmonary disease, or COPD. Patient is a longtime smoker who was diagnosed with COPD 2 years ago. She complains of trouble breathing for the last 4 months, coughing fits with bronchospasm, and phlegm for 2 weeks that varies from clear to yellow, gray, or dark color. She states that her formoterol inhaler is no longer helping with the shortness of breath, and she has tried to quit smoking in the past, but it didn't last. She knows that's part of her problem, and so she's here to get help with that as well. So, tiotropium dry powder inhaler, or Spiriva, is ordered in addition to the patient's formoterol inhaler to treat the bronchospasms due to her COPD exacerbations. The medication works by inhibiting M3 receptors in the smooth muscle of the airway, relaxing that muscle and opening the airway. This medication is absorbed into the respiratory tract and excreted in the urine. Contraindications include use in a patient with hypersensitivity and concurrent use of ipratropium. It should also be avoided in pregnancy, breastfeeding, and in children. The only drug interaction is with the ipratropium, creating a high risk of additive anticholinergic effects. The side effects of Spiriva are glaucoma, tachycardia, dry mouth, constipation, urinary retention, and possible angioedema. The patient education should cover all of these side effects, as well as informing the patient to take the medication as directed, and that the capsule should never be swallowed, only used in that inhaler that's provided with them. This medication should not be used for acute attacks of bronchospasm. The patient should rinse her mouth out after taking it, and she should notify her provider about any symptoms of angioedema or allergic reaction. For acute exacerbations, this patient was prescribed a combination inhaler to prevent the extra inhaler use. Now she's already got 2, so now we have another one, while providing relief. Albuterol ipratropium, or the Compivent, is a bronchodilator, anticholinergic, and adrenergic medication. It inhibits cholinergic receptors in smooth muscle, resulting in bronchodilation. It is metabolized by the liver and other tissues, and it is found in the breast milk. Compivent is contraindicated in those with hypersensitivity, glaucoma, urinary retention, or those with any allergy to soy or peanuts. Drug interactions include medications with anticholinergic properties, adrenergic agents, as they will increase the side effects. Use with MAOIs may also result in a hypertensive crisis, and then use with beta blockers may negate the therapeutic effect. This medication will probably decrease the serum digoxin levels, so those have to be checked often, and cardiovascular effects are potentiated in patients using tricyclic antidepressants. A lot of stuff to look for in this one. Side effects include nervousness, restlessness, tremor, chest pain, palpitations, nausea, vomiting, GI upset, headache, and sore throat. Patient education should include the side effects in addition to proper use of the inhaler. Patients should take as directed and not exceed 12 doses in 24 hours. Sometimes they need to be told this. She should rinse her mouth out after use with this one also, and notify the provider of if symptoms do not improve in 1 to 2 weeks. The varenicline, or Chantix, is a smoking detergent, nicotine agonist, and it selectively binds to nicotine receptors, resulting in decreased desire to smoke. So this is the one that we're using to help with smoking cessation. It is excreted in the urine. Chantix is contraindicated in those with hypersensitivity, renal impairment, cardiovascular disease, psychiatric illness, and in breastfeeding women, as well as in children. Chantix can decrease the effectiveness of medications such as theophylline, warfarin, and insulin. Nicotine replacements like gum and the patch can increase the possibility of adverse reactions with this medication. Shouldn't be a problem for this patient because she tried using those in the past and they didn't really work, but it's worth noting. The side effects include stroke, suicidal thoughts, anxiety, depression, insomnia, irritability, dizziness, restlessness, agitation, aggression, amnesia, disorientation, blurred vision, migraine, diarrhea, nausea, hyperhidrosis, musculoskeletal pain, restless legs, and muscle cramps. A whole bunch of stuff to look for, so it's really important to let them know all of these things are possible. Patient teaching should include information about possible side effects. Patients should be instructed on how to take medication and how to set dates on quitting smoking and when to start the medication, which should be about a week before she quits smoking. Also including how to schedule the dosing for the best results, since it's you have to change the what dose you're taking each day. Patient should notify provider of any symptoms of allergic reaction. And the patient should be provided with educational support materials such as counseling and cessation groups to aid in her quitting the smoking. It shouldn't just be taken, just give that and tell her to go. She needs some help too. So alternate medications for COPD would possibly be a formoterol budesonide inhaler or a Symbicort. So this would be an alternative to help with long-term management as well as cut down on one more inhaler. The inhaler that we added earlier was going to be in addition to her formoterol, so this one would get rid of the extra inhaler but give her a different medication to kind of help just a little bit more than the formoterol was. The more combinations in one inhaler, obviously the more productive, the higher instance of compliance will be. So this is a long-acting beta-2 agonist. It's a bronchodilator and adrenergic that prevents bronchospasm and dilates airway by relaxing smooth muscle with the accumulation of cyclic adenosine monophosphate, or CAMP, and beta-adrenergic receptors. It's metabolized by the liver and excreted in the urine. Symbicort is contraindicated in those with hypersensitivity, acute asthma attack, cardiovascular disease, diabetes, glaucoma, hyperthyroidism, pregnancy, breastfeeding, and in children. This medication can cause problem in those taking MAOIs, tricyclic antidepressants, and other agents that prolong the QT interval. Risk of hypokalemia in patients taking potassium-losing diuretics and corticosteroids is also possible. Beta blockers may decrease the effects of this medication, and use with other adrenergics may potentiate and increase side effects of this medication. So anybody with some heart issues is really going to have to be careful with this medication. And unfortunately, COPD goes along with heart problems sometimes, so this is something that's important to know. Side effects of Symbicort include dizziness, fatigue, headache, insomnia, nervousness, angina, arrhythmias, hypertension, hypotension, palpitations, tachycardia, dry mouth, nausea, hypokalemia, and tremor. Again, lots of heart stuff. Patient education should include information about all of these side effects. Patient should take this medication also as directed and be instructed on the correct use of the inhaler, just in case she doesn't know. She should also have a rescue inhaler available, like the one that we prescribed, and patient should be advised to contact healthcare provider if shortness of breath is not relieved or if the symptoms get worse. Provider should be notified of any over-the-counter medications as well, because it can interfere with some of this. The next patient has both hypertension and diabetes mellitus type 2. This patient is a 38-year-old male following up with concerns about his hypertension and his diabetes. He's gained 15 pounds over the last few months, has had increased urination for the last month, and has been feeling tired or just quote-unquote blah. He doesn't eat well or sleep well. He has a limited budget, and he is already on metformin for diabetes and hydrochlorothiazide for hypertension. He's also on escitalopram for anxiety. So a lisinopril hydrochlorothiazide combination was prescribed. Lisinopril is an antihypertensive and an ACE inhibitor. Hydrochlorothiazide is also an antihypertensive, and it's a thiazide diuretic. The medication works in several ways. Lisinopril blocks the conversion of angiotensin 1 to angiotensin 2, which results in the prevention of vasoconstriction. It also prevents the degradation of bradykinin, which is what helps with vasodilation. The hydrochlorothiazide reduces hypertension by inhibiting the reabsorption of sodium in the kidneys, which leads to the excretion of the sodium and with it, the excess water. Both medications are excreted in the kidneys, and lisinopril hydrochlorothiazide is contraindicated in patients with the hypersensitivity, anuria, renal or hepatic impairment, those who are pregnant or breastfeeding, use with antihypertensives, diuretics, and alcohol can actually have additive effects resulting in hypotension, and the use of corticosteroids and some penicillins can cause hypokalemia. NSAIDs may decrease the effectiveness of this medication. Side effects include dizziness, drowsiness, fatigue, headache, insomnia, vertigo, weakness, cough, hypotension, and taste disturbances. Patient education should include warnings about all of these side effects. The patient should be instructed to take the medication as directed and to avoid foods with high sodium and potassium. The taste impairment should resolve in 8 to 12 weeks, and it's normal, so it's important to tell them that. The patient should be reminded to change positions slowly when getting up to avoid orthostatic hypotension. Women should use contraceptive, as this medication is contraindicated in pregnancy. Patient should follow up with provider to ensure medication is working properly. Losartan hydrochlorothiazide is another medication that could be used for hypertension. It works by blocking the converted angiotensin 2. It's already been converted, but it blocks it from binding to the smooth muscle cells of the vascular system, which results in the prevention of that vasoconstriction. It also inhibits the reabsorption of sodium in the kidney, resulting in the elimination of excess sodium and water. That's the hydrochlorothiazide in it. This medication is contraindicated in those with hypersensitivity, anuria, lactation, renal or hepatic impairment, and pregnancy. Interactions are all the same as with the lisinopril mix with the hydrochlorothiazide. And all the side effects and patient education are again the same as the lisinopril with the hydrochlorothiazide. It's the same drug class, just works a little bit differently. It catches that angiotensin 2 instead of before it's converted over. Okay, so for the diabetes, The glipizide metformin combination medication was prescribed. It's meant to assist the patient in both the control of the diabetes as well as help with medication costs. That's why we did a combination pill. This is an anti-diabetic, biguanide, and sulfonylurea that decreases hepatic glucose production, increases sensitivity to insulin, and stimulates the release of the insulin from the pancreas. This medication is contraindicated in hypersensitivity, type 1 diabetes, metabolic acidosis, dehydration, sepsis, hypoxemia, hepatic impairment, and alcohol use, and of course, renal dysfunction. This medication interacts with alcohol consumption, contrast media, amiloride, digoxin, morphine, procanamide, ranitidine, triamterene, calcium channel blockers, furosemide, nifedipine, glucosamine, chromium, and other OTCs. The side effects include abdominal bloating, diarrhea, nausea, vomiting, photosensitivity, and hypoglycemia. So a couple kind of weird ones, but a lot of it has to do with the over-the-counter drugs. Patient education should include all side effects. The patient should take this medication as directed. Patient should follow a prescribed diet and exercise regimen and check blood sugars on a regular basis. This is a patient that wasn't very compliant with all of that, kind of just ate whatever and needed to think about that a little bit better for his health. This medication may cause a metallic taste that should be resolved. That's important to know so they don't think something's wrong and that it should go away. And the patient should report GI problems such as diarrhea, nausea, vomiting, and stomach pain. The importance of routine follow-up exams should also be stressed because this patient's a little bit non-compliant with things like that. The alternative medication is similar. It's the glimepiride metformin. It's another combination medication meant to assist the patient in both the control of his diabetes as well as help with his medication costs. It's the same thing. It's an anti-diabetic, sulfonylurea, bigonite, that decreases hepatic glucose production, increases sensitivity to insulin, stimulates the release of the insulin from the pancreas. This medication is contraindicated in hypersensitivity, type 1 diabetes, metabolic acidosis, dehydration, sepsis, hypoxemia, hepatic impairment, alcohol use, and renal dysfunction. This medication, since it's similar, has all the same interactions. Sometimes this one is just easier to get, which is why it's a good alternative. It doesn't really work any differently. It's in the same drug class. So the education, side effects, everything is the same as the glipizide with the metformin. All right, this final patient has lower back pain and requires pain management. So this is a 30-year-old transgender male patient who had back pain for the past 13 weeks following an injury lifting a heavy box at work. He tried over-the-counter ibuprofen, was apparently given a prescription for ibuprofen, doesn't remember the dose, didn't pay for it, didn't take it, and then just bought some over-the-counter ibuprofen, was taking the 400 milligram dose. So he was taking that dose on the box. He wasn't getting any relief. He started drinking for a couple of weeks to make the pain go away, and then his friend gave him some hydrocodone with Tylenol, and he started taking that, apparently stopped drinking while he was doing that, and he did say that it helped, so he was coming in to get some more of that. So after assessment, this patient is given ibuprofen. It's given ibuprofen at an appropriate dose for him, and it's due more to his high risk of addiction to narcotics. He does heavily drink. He admitted that he did that. His mother was an alcoholic, so he's got some high risk factors for getting addicted. So we're just starting with ibuprofen. That anti-inflammatory seems like it should work for him, and it's the first line indicated for this type of pain. So ibuprofen is an antipyretic, anti-rheumatic, non-opioid analgesic, non-steroidal anti-inflammatory agent, and non-opioid analgesic that treats mild to moderate pain fever, and inflammation by inhibiting prostaglandin synthesis. Ibuprofen is metabolized in the liver, therefore it is contraindicated in patients with liver dysfunction, and it's also contraindicated in those with hypersensitivity to it. Patients who use or abuse alcohol, have active bleeding or peptic ulcer disease, or those who are pregnant. Interactions include aspirin, other NSAIDs, corticosteroids, alcohol, acetaminophen, diuretics, ACE inhibitors, antihypertensives, insulin, oral hypoglycemic agents, and antineoplastics. So seems like a pretty innocent over-the-counter drug, but there's a lot of interactions. Some side effects of ibuprofen include headache, dizziness, drowsiness, psychic disturbances, constipation, dyspepsia, nausea and vomiting, abdominal discomfort, renal failure, anemia, and prolonged bleeding time. Patient education should include all of these side effects, and the patient should take the medication as prescribed. That needs to be enforced with him. It needs to be with a full glass of water, and it would be helpful if he remained upright for 30 minutes after. He needs to know that drinking alcohol may increase the risk of bleeding. He does seem to enjoy having some drinks, so it's important for him to know that. And the patient also requires education on not taking medications that are prescribed for other people. The alternative would be another NSAID like naproxen or Aleve. This patient really needs to try an anti-inflammatory pain reliever before trying the narcotic medications. This is an alternative, but it will work in the same way. So the side effects, because it's an NSAID, they're the same as ibuprofen. They include the headache, dizziness, drowsiness, all those same side effects. The patient education, again, is the same and just needs to be reiterated not to take medications that are prescribed for other people. So, prescribing medications is a great responsibility. It includes having the knowledge of medications, what they're used for, and being able to know what the resources are for looking some up if you don't know anything, if don't know something about them. Obtaining a full history and physical for the patient is critical because there could be some underlying issues or disease processes that may need to be addressed or may help with the current complaint. This also includes obtaining a full list of medications a patient is taking, including over-the-counter and herbal medications. Once the medication list is completed, the provider must keep the medications in mind when prescribing new ones to make sure there are no issues between them. Of course, it gets double-checked at the pharmacy, but stuff happens. Patient needs and requirements are the final part of this equation. We have to think about what that patient needs, evaluate possibility of compliance, any barriers that patient might have that might keep them from taking this medication. We have to think about all of these things, and they're all key to providing the best care possible for that patient and coming up with the most appropriate prescription regimen for him or her. All right, that's it. Any questions? Thank you very much for your time. And there's a list of references. Thank you.